Hello, I'm Dr. Deborah Toppmeyer, Chief Medical Officer and Chief of Medical Oncology at Rutgers Cancer Institute of New Jersey.
And I'm Dr. Carolyn Hayes. I'm the Chief Nursing Officer for Rutgers Cancer Institute of New Jersey and RWJ Barnabas Health Oncology Service Line. In March, along with all of New Jersey, most of the nation and the world, we had to slow down and take a step back and think about how we could protect you and ourselves during the pandemic.
Now that we are past the peak of the pandemic, we at Rutgers Cancer Institute of New Jersey, the state's only National Cancer Institute designated comprehensive cancer center, would like to welcome you back. Many of you chose to reschedule your routine care or delay treatment with the okay of your physician until we were past the peak of the pandemic. But again, we welcome you back, and we want to discuss some of the important strategies, policies, and procedures we put in place to make sure that you are safe, visitors are safe, our staff, and our faculty.
So in March, we began a journey about how to protect you. We began to take a look at how we could, inside our walls, make sure that you and all of us were as safe as possible.
Please let me share with you some of our policies and procedures to make sure that you are comfortable coming back to Rutgers Cancer Institute of New Jersey. First and foremost, we have aggressive screening measures in place. This includes calling each patient prior to their visit and asking several questions, screening for symptoms consistent with the coronavirus, any exposure to the coronavirus, and of course, fever or cough.
Importantly, I want you to know that our cleaning practices start before you even enter the Institute. Our valet parkers have been instructed on how to make sure that they are not transferring any virus to your car and that they are not picking up anything from your car. Once you enter the building, you'll be greeted at a screening table by our staff. We're going to again ask you those questions. We're going to take your temperature with an infrared thermometer. We're going to insist that you wash your hands with our hand sanitizer, and we're going to give you a mask that you need to put on as you traverse throughout the Institute. We too will have masks on, as every morning I have my temperature taken. I'm given a mask, I wash my hands, and I run through that list of questions.
We have taken unprecedented measures to make sure that our institute is clean. High-touch surfaces are frequently cleaned by our housekeeping staff and even our nursing staff. You'll also notice that throughout the Cancer Institute, we have multiple areas that you can wash your hands, sanitize your hands, which is critically important. In the clinic space and in the treatment area, we are practicing social distancing. We are making sure that patients who are awaiting a physician appointment are at a safe distance from the next patient.
Before we schedule anything invasive, such as surgery, we're making sure that you're tested. If you're going to go to radiation oncology and get fitted, we make sure that you're tested. If you're going to be admitted to the hospital to have some chemotherapy, we make sure you're tested.
During your first visit with your oncologist, your first consultation, you can bring a loved one or a friend. Unfortunately, during your first infusion treatment, you cannot bring a loved one or a friend. Again, this is for your safety and to maintain social distancing in our infusion area.
We've done what we can to make sure that everybody is 6 feet apart. We've labeled sidewalks. We've labeled our floors. We've put up plexiglass shields. All of these things we've done to keep you safe. Please understand, there are exceptions, of course. Every pediatric patient must bring an adult with them to be able to consent to treat. There are patients for whom we cannot, even though we are very proud of our diverse workforce, offer that language just to navigate through the building. So we have made exceptions. Please talk to the screener when you have that call the day before to see if you have an exceptional circumstance. Lastly, I just want to thank you. Thank you all. Thank you for staying home. Thank you for staying safe. Thank you for wearing masks. Thank you for sanitizing your hands. and thank you for trusting us with your care.
And we welcome you back to Rutgers Cancer Institute of New Jersey.